You're going to get handed a bag of not so ideal things in life. And so you just have to navigate through it. And that's really what I would advise anybody who's about to start off on this journey. I think solo practice still has promise, even though it may appear on the outside that's not the case. And you have to have a DSO. I don't know about that. I think solo practice is a wonderful thing. I think it's easy to put your hands around and run it. And sure, if you want to have no headaches and you want to affiliate with a DSO, I think that's a great idea too. I don't think there's anything wrong with that. And I think there's plenty of room in the market for all types of different practices.
Hey there, dental economist. If you're a dentist owner or a leader within a dental business thinking about growing production, case acceptance, patient and staff satisfaction, positive outcomes, and everything else that comes with running a dental business, then you're a dental economist, and you've come to the right place. Welcome to the Dental Economist Show. We're meeting at the intersection of profit and purpose as I sit down with dental leaders who share their stories about dentistry, business, and growth. Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we're talking with Vilas Sastry, a longtime dentist and dental businessman who's the founder and CEO of Teledentistry.com, which impressively serves over 140 million patients. Vilas has also just recently been announced as an advisory specialist for the Nevada Department of Health and Human Services, helping them introduce modern technologies into their systems. Welcome to the show, Vilas. How are you today?
I'm doing great, Mike. It's a privilege to be on your show.
Thank you. I really appreciate you joining. Looking forward to talking about teledentistry and a bit about your career. Let's just kind of start with how you ultimately came to found Teledentistry.com.
It's an interesting story where basically when the recession took place in 2006 and 2007, it became apparent that a lot of people were more interested in focusing on their dental pain issues and emergency needs, more so than other forms of dentistry at the time. And so around 2016 to 17, I started doing a lot of market analysis in terms of like how, we might end up in a recession in 2020. And there was a lot of talk at that time. And so we decided to, myself and my co-founder, we decided to set up about a system that would help people, in the event of an emergency. And we went about creating Teledentistry.com.
Very cool. So now teledentistry as a concept, what exactly does that mean to you?
So it's a way for a dentist to connect with a patient through a virtual conference. That's in a nutshell what it is. Now, so much more to that and the different applications and use cases and frankly, how it's deployed in different industries. And that's where it starts to get kind of interesting and kind of like how form the basis of how people interact with each other going forward here. And I think that's where really you have to look at it from the point of view of ground zero, if you would, was really the pandemic for teledentistry. It's when it became readily apparent that this type of a service and technology is needed. And if you fast forward 20 years from now, what this is going to look like, honestly, I don't know. But I can tell you that it's going to evolve and we're on the forefront of changing it and evolving.
When I kind of had first heard about the concept, I was like, well, it seems like it would be limited in scope. And I initially had a challenge kind of understanding what all the applications could be, how it could be helpful, both for the clinician and also for the patient. A lot of that seemed to clear up in the way that I was thinking about it during COVID because there was obvious applications there. But when you think about it as you move forward, what are some of the things that people are doing with it now? What are you able to solve for? What conveniences can you provide to your patients? And what are the benefits that it provides to the practice?
The first and most obvious one is our flagship service, which we've implemented for almost 80 insurance carriers, which is our emergency consult solution. And from there, we've evolved significantly to start including basically an entire wellness package for dental insurance companies. And that's where it starts to get kind of interesting because if you really were to think about a wellness platform for any kind of an insurance product, that typically is something that has a lot of educational content and stuff. And you go there and you learn things and then you hopefully implement. You can't really get anything from it. Unlike on the medical side, where you can get a Fitbit watch, maybe, or a gym membership, which might be kind of cool. On the dental side, there really isn't anything like that. Well, we've created it. And so now we've got basically tobacco counseling programs, for example, that are run by licensed dentists. I think if anything, we should own as dentists tobacco cessation programs. I mean, that's a thing. Maternal oral care. So an interesting thing that I've experienced personally in private practice, and maybe others have as well, is somebody who's pregnant or maybe has recently delivered will get a lot of attention from their OBGYN for obvious reasons. And despite how much of effort we as clinicians provide to the patient during this process, they're getting as much attention as we can give to them. But there's like a maternal oral care program, which really educates women on how to care for their oral health environment. And then after they deliver, how to care for those newborn child. And those are the kinds of programs that we're able to implement. And they really resonate well within the community as far as benefits programs goes. And those are just two things that I'm just mentioning right now. There's a whole slew of different programs we put together for folks who are insured and who have access to these programs.
I'm realizing, and I apologize for this, I didn't introduce you properly. You are Dr. Vilas Sastry. And so my apologies for that. You've been a clinician for quite some time now. Can you talk us through a little bit about your dental career?
So I graduated from Boston University. When I came here to the United States, I was born here, ended up back in India. That's a story in and of itself. And then finally got into Boston University as the advanced dental program there, and then started my first practice in Las Vegas shortly thereafter. So that was in 2005 that I graduated. But it's been a good number of years that I've been in private practice here.
I don't think I can let this go. So you said you were born in the United States, and then you were in India and you moved back here. You and I had spoken previously, and you shared a bit of this story. And I'd just love if you could kind of tell the audience about that journey and kind of what transpired to set you on that path.
So for those of you who are listening to the podcast, Mike and I go a ways back. So that's why he's putting me on the spot. But that being said, so essentially around sixth grade, when I was in the California area, I was getting into a lot of trouble. Let's just put it that way. My mother was like, hey, you know what? Your grandfather's ill and we need to go visit him and take care of him essentially. And this is, back in India. So we all hop on a flight and we go there, and he just took me off. And I was like, hey, perfectly fine. Like, what's going on here? And my mom just turned around and got back on the flight and left. And so she was like, if you want to come back, you're going to have to either study or work and then come back. So I had to study my way back to the United States. So, thank you, Mom. I became a dentist.
When did you decide in that journey? So sixth grade, now you're living in India unexpectedly. You're given these two choices. You're with your not so sick grandfather, and you have to make these decisions, and really kind of a pivotal moment in your life and the path that you were going to take. When did you decide that like a career in medicine and pursuing becoming a dentist was going to be something that you wanted to do?
Well, initially, it wasn't so clear cut. My first instinct was to just work and somehow scrounge up enough money and then just get back. That did not work out so well. So kid after all. And so it's like, okay, go and study. And so I did take several exams and I got into dental school, quite frankly, in India. And after spending some time and learning about it, I discovered I just loved it. And obviously very hands-on and the kind of person I am. And got to play with a lot of tools. Let's just put it that way, And so that was kind of fun.
That's awesome. And then did you return to the US when you got into Boston for dental school, or?
Yeah, I returned and then I took the exam and I got into BU, and then there you go. And so then from there on was just pretty much a straight shot out. But I had it in my mind that I wanted to move to Las Vegas. That was like a thing for me, and so I made it every effort to do so.
All right, so you moved to Las Vegas. It was a goal of yours. Did you open up your own practice? Did you join another practice as an associate? Kind of what was that path?
I bought another practice. What I was told was gold mine, and it turned out to be like, a rotten lemon. Forget about being a regular lemon. You couldn't even make lemonade out of it. But, you make some mistakes along the way and you live and you learn, and then you just keep going, right? So I think that's really the story of it all. It's like just persistent and not letting things kind of get you down, because you're going to get handed a bag of not so ideal things in life. And so you just have to kind of like just navigate through it. That's really what I would advise anybody who's about to start off on this journey. I think solo practice still has promise, even though it may appear on the outside that's not the case. And you have to have a DSO. I don't know about that. I think solo practice is a wonderful thing. I think it's easy to put your hands around and run it. And, yeah, sure. If you want to have no headaches and you want to affiliate with a DSO, I think that's a great idea too. I don't think there's anything wrong with that. And I think there's plenty of room in the market for all types of different practices.
I agree. There's a theme of overcoming adversity here and being persistent and working through challenges. And I think that's something that, all of us have to work through in life. And that's kind of, as my dad used to say, that's what build character, right? That's the scar tissue that helps you continue to face challenges in the future. So after Las Vegas, you joined Elite Dental Partners, which is a large DSO in the Midwest. Tell me a little bit about making that decision and how that experience has been.
So I sold my DSO in 2020 at the end of the pandemic and decided to focus full time on Teledentistry.com, which was the right decision. And really, it's been an incredible ride because we're able to continually grow the company virtually. And what I ended up finding was that my mind was thoroughly occupied with Teledentistry. However, I felt that my skill sets may be starting to wane, if that makes sense, because you lose that touch, if that makes sense, and the clinicians who listen to this will understand completely what I'm talking about. And so I thought, okay, let me just get back into prior practice a little bit and see how I feel, how I'm able to manage both. And lo and behold, I was able to manage both really well. And I was like, okay, so I can do what I'm doing on the virtual side of the business. And by the way, I'm not giving enough credit to my team when I'm saying this because we have a very large team on the Teledentistry.com on that side who handle a lot of what I would ordinarily have to deal with. And so that's a real benefit. And by leaning on them, I was able to in turn return to prior practice. And by the way, Elite Dental Partners knows full well of my company, and they in fact condone it. They're on the cutting edge of a lot of different technologies, and it's a wonderful DSO to work for. So much so because they handle so much of the day-to-day business headaches that I don't have to, which I was handling in my own DSO. And I can just focus on prior practice, which is a joy, actually. And so for those clinicians who just kind of get into it and really enjoy the actual practice of dentistry without the headaches of running a practice, it's a lot of fun, actually. And it's really fulfilling. And so that's why I decided to rejoin full time. They're happy with it, and I am as well. And so it's a great partnership, I think.
No, it is. That's a great example. And it's really a fantastic representation of the benefit that can be received if you're working with a service organization that's really there to support their practices. So going back to teledentistry.com and you're talking about your team, and what are the most important things from your perspective related to leadership and to being a leader?
This one came to me after many, many years of making mistakes. I will say this. And it is listening intently to your own team members. I will say that. Oftentimes during the middle of a conversation, me personally, I might interrupt somebody and they'll have a thought, but I always restrict myself and I say, no, let them say what they have to say. Because once that idea evaporates from the mind, if that makes sense, and it's lost, and I don't need to just hear myself talk. It's important for the rest of the team to have their voice heard and to have their input make a difference. And so that's what I've learned.
Yeah, I love that. Oftentimes overlooked, and it is so important. And I think for a lot of leaders, it's a challenging thing to do because your brain's always on and you're always thinking the next thing. Actually, you might appreciate this. We do a book club in our organization with our revenue team. It's all the sales and marketing folks, and it's optional, of course. But the book that we're reading for this one, it's called STFU, and it's basically like the art of staying quiet so that you can actually listen to what other people say, and like maybe your opinions don't always need to be shared. So I was just smiling when you were talking about, hey, listening is super important. So let's go back to teledentistry a little bit. What does the service look like? Who is your ideal customer? And what does an engagement with your company look like?
So right now, we are working with 80 insurance carriers. We partner with them to implement our solution, which is a 24/7 emergency service line where you can access a live dentist 24/7. We're also in the process of implementing what we've called our MESH platform, which stands for Member Engagement for Sustainable Healthcare. And so that's a platform that engages with the entire membership of an insurance company, like millions of members at a time. And it drives them to utilize their benefits in a meaningful way. And so we're talking to them about, a lot of times people don't even know what benefits are available to them through their insurance. And so by sending them text messages in a timely way, email reminders, and those sorts of like engagement, digital engagement, you're able to effectuate the likelihood that a member will actually use their benefit, which is what, interestingly enough, insurance companies do want. So a lot of people in the dental industry, dentists believe, and I've heard this over and over again, it's like, oh, insurance companies don't want people to use their benefits. Well, they don't want people to use their benefits in a fraud, waste, and abuse way, but legitimate use is encouraged. And so preventative use is encouraged. And so I think that's where there is a confluence of ideals on the insurance side, because they want people to access more of their preventative benefits, which typically they don't. Unfortunately, they're always, in my practice today, we have so many emergencies. They had just been addressed in a timely manner, then they would not be emergencies. Why wouldn't, that's the whole point, right? And that becomes like a catastrophic utilization of the benefit. This is how insurance companies look at this. So they want to partner with dentists and clinicians to actually encourage preventative type measures. And so we're helping to effectuate that and encourage people to go visit the dentist earlier, get the simple things done, rather than wait for things to just blow up in your face and then you're coming in for some kind of obviously an extraction root canal or something else. It's a very, painful event.
So Vilas, you mentioned that it allows for patients to pick up the phone and they can talk to a dentist at any time, and you work with a lot of insurance carriers. If you want to be a provider that's available on the other end of that phone, is that something that you also facilitate with teledentistry.com? And how does that work?
Absolutely. So any dentist who is licensed in the United States can join our company and then provide these type of services. They just come to our teledentistry.com. Just go to teledentistry.com, go all the way to the bottom of careers, and then you can apply, and then you can then be put into the queue, basically, wherein whenever a patient has a need, they'll then contact you. Our call center will contact you and then say, hey, we have a patient, John Doe, who has the need for dental emergency, who has a dental emergency or whatever other need. Do you have some time to spare to provide this consultation? And we have entire dentists who have given up their private practices to just focus on this full time. That's how high the demand is. And it's just an incredible compliment to what we've been able to do as a company. And I'm very flattered by it. And in fact, even other dentists, some folks who are disabled, they can't do clinical practice anymore. They've joined us and now they are doing just full-time teledentistry. And so that's kind of how it's working out.
That's really interesting. So are you able to bill the consultations? Do they bill through insurance? Are there different procedure codes for that? What is billable versus is not? Can you talk us through a little bit what that looks like?
There are specific teledentistry codes that have been put forth by the ADA, and so that's out there. You can bill for those. And we also have our own arrangements with the insurance company that also helps facilitate some of those cost-sharing needs, and so that kind of thing. So, and in some cases, patients just pay for it themselves. If they don't have insurance coverage, it's way better to use our service and get the care they need than sitting in an emergency room for 4 hours on end. And in fact, getting the same exact results anyway, which is an antibiotic and a prescription for something, and then go to your dentist on Monday. So that's like 90%. That's 90% of the non-traumatic type of dental emergencies that go to an emergency room.
It's so much better to keep them out of the emergency rooms as well for those that have other injuries. And emergency rooms probably are not generally the best equipped necessarily to take care of dental issues and problems.
They're simply not equipped for dental procedures of any kind, barring like a cellulitis or like a huge infection. That should go to the emergency room. There are indications, but our dentists who join our company are trained on our teledentistry triage protocol, which tells you when a patient should go to the emergency room and when they should not. And so, this is like a highly clinical environment, as much of it is virtual, but that's the way we've kind of created it because, well, that's the way it has to be. So it has to be clinically led and clinically sound for it to work. It has to make sense to the patient at the end of the day. Or could have all the tech in the world, it doesn't matter, but it has to make sense.
So you mentioned that, there's a need for this, obviously. Can you give a sense of kind of how large that need is, how frequently there are patients that are using the service and kind of what that looks like?
I'll just say this. The ADA put out a report on emergency room usage and expenses at the emergency rooms. And this was back in 2018, I believe the report came out. $2 billion are spent annually at the emergency room for these types of procedures. That's just a horrendous amount of money that's being spent for something that can be easily handled outside of the ER. Those are patients who are actually physically going to the emergency room. Then there's this whole cohort of people who will just somehow suffer and not go the emergency room. So that's where the ability to provide care in this interceptive manner really kind of shines. And by the way, we're not just doing a consultation and saying, here's an antibiotic, here's some pain medication, no controlled substance, of course, and then bye-bye. We're actually telling them, hey, John Doe is your dentist who is in network down the street from you. This is his telephone number, his address. Go see him on Monday. So in reality, it is quite literally and better than the service that you would get at the emergency room. Again, without any controlled substances. Of course, we can't do surgeries and stuff in the case of cellulitis. Those are the kinds of cases that shouldn't go there. But if you really were to kind of put it all together, this is a huge boon for the patient because now sometimes these folks don't even know where to go. They have no idea that who the dentist is in network and all these kinds of factors and complications that take place that prevent sometimes the person from going and seeking care that they need.
What are some of the things that you're most excited about when you look at your business and what's to come in the future? Anything in particular that you guys are working on right now that that's kind of firing you up?
There's a lot, actually. Some of it is under wraps, but I will say that because we are working with so many insurance companies, what we are privileged to be able to see is how incredibly uniform the experience is for an individual across the insurance spectrum. So there's a lot to learn there. And so therefore, we're able to create solutions that can improve all of their experiences. So that's how we kind of like create our program. So we basically say, okay, we have 80 insurance carriers we're working with. We have 140 million lives that we are caring for essentially through these programs. Almost across the board, we have a lot of data that we can kind of sift through. It's literally metadata that we're looking at and then determining how people react to the programs we provide. And in some cases, they don't react very well. And so we know it's a dead program. And in some cases, they react really well. And we learn a lot. And in those situations, we're able to then say, okay, now let's take that one and apply it across the entire line of insurance companies and offer this as a solution that we know works well. And so that's how you're going to see improvement in the experience for members of these insurance companies. And then in turn, dentists on the ground will also see in their private practices and brick and mortar practices the effects of digital engagements with people and how that impacts them in their private practices.
So can you give an example of like what one of those programs would look like that you would be able to end up spreading and doing in a more broad manner?
Yeah. So we ran a couple of pilots for a Medicaid company in Michigan. And this pilot involved a survey wherein we send the survey to the member electronically, and they would upload a bunch of photos of their smiles to the survey. And then we analyzed them, and then we sent them back a report. And then we said, go see your local assigned dentist. In this case, they had a dental home, like a physical dental home. This particular Medicaid had that set up. That program just took off. Like we ourselves could not believe just how many people availed in that program. And so the number of people in that pilot were 300,000 people. And the engagement was so high that we then said, okay, we're going to internalize this data and then apply it across the board. And now that same program is now available to 37 million people in another insurance company. And so now people are now engaging and submitting their photos and getting reports. And so when they get that report, now they're getting essentially like a precursor to what they can expect from a dentist when they go in and see their in-person dentist, who will be referring them to as well, by the way. So it's like, so they submit the survey, we do the analysis of the photos. It's not some AI photo analysis gimmick, by the way. This is like an actual dentist looking at the photos and saying, okay, well, this has got this problem, that's got that problem. Here's what I think you need to do. And then this is probably what your dentist on the ground might tell you, some possible outcome. And that report gets sent to the patient. Now, the good news is when that patient then goes to the actual dentist in the brick and mortar practice, right? Now they have a higher likelihood of believing what the dentist is going to tell them, because it has happened so many times where it's like, well, patient just comes in and like they've never had a single issue with their teeth and then no pain or something. And then suddenly the dentist goes, well, you have a whole bunch of cavities in your mouth and, you need this and you need that. And then they go, I don't believe this dentist and, all that kind of stuff. Right. And so you're probably a scam artist. When in fact, they were probably right. So we're able to kind of like provide that additional level of support. And so when they go in and see the dentist in person, case acceptance will be higher. And we demonstrated that in our Medicaid experiment earlier.
So it benefits the patient, benefits the practice. I would imagine also, I can see as a patient, it could maybe reduce the fear of the unknown before you walk into a practice where, you're like, hey, I don't want to go to the dentist. They're going to tell me all these things. And, you can have kind of a pre-opinion provided where you're like, okay, now at least it's a little bit less threatening before I go in. Is that an outcome, or am I imagining that's not really something that would be beneficial to the patient?
The psychological benefits of this are tremendous because, and this is a conversation we have with the dentists who join our platform to provide services, is that guess what? You're primarily going to be providing psychological services to folks because they're in not so much in that you're a psychiatrist or a psychologist, but we all know dental psychology. There is an actual field of study in it. And so you must know this because your only interaction with the individual is virtual. You're not able to be there in person. So that's the feature. And that's a characteristic that we look for in some of our top providers who are with our company right now. And so they're just really nice people, and so that's great. That's what you want, and so the patients love it. And so that's the whole point.
We'll wrap up here in just a second. Where do you go to learn? Are you a book reader? Do you like podcasts, audiobooks, anything? Like what is your approach there?
Well, I love podcasts, as you probably know. So that's the big area I go to learn for sure. Besides that, I have to say, I actually actively seek out what I don't know. And so it's interesting. I'll just kind of sit in the day and be like, okay, what is it that I'm missing here? And if I find that that's the case, then I'll go and start learning about it. And sometimes it's online, sometimes it's books, just depends. I find that more of my learning is now taking place online than not.
Vilas, I really appreciate you joining today. How do people find you? What's your website? What's all the information for contact?
I'm available on LinkedIn. That's the quickest way to get in touch with me. Send me a message, and I'm extremely active over there. So just look me up, and I connect with everybody who says hello.
Perfect. Well, thank you so much. I appreciate it.
Absolutely. Thank you so much, Mike.
The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.